You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, mommy makeovers. With us, we have San Francisco's hottest plastic surgeons, Dr. Poulos and Dr. Hvistendahl. Welcome to the program.
Randy, it's great to be here.
Great to be here.
Now, before we get into today's topic, I guess you're the founder, so I'll start with you. Tell me a little bit about your practice.
We're located just outside of San Francisco, about 10 minutes north of the Golden Gate Bridge. And we specialize in all aspects of aesthetic plastic surgery.
Now, you're both board-certified plastic surgeons.
That's correct.
Is that right? So who is your typical patient? Do you do everything?
Well, we basically specialize in aesthetic plastic surgery.
Okay.
You know, that encompasses facial rejuvenation surgery, which includes the brows, the eyes, nasal changes, rhinoplasty, facelifts, of course, breast surgery, breast enhancement of all categories, tummy tucks, liposuction, which kind of leads us to what's become our major specialty, which is mommy makeover.
Mommy makeover. Now, you two are known as the mommy makeover surgeons, the busiest guys in San Francisco. So, and I'll ask you, how did you, why mommy makeovers?
Well, it's sort of a unique procedure to do because what you're trying to create for everybody is to make them really feel good about themselves and their bodies.
So you both have the same techniques or philosophy when it comes to breast and tummy tuck and lipo.
Yeah, I think that's true. In order to be a mommy makeover surgeon, you first have to be an expert in those procedures that make it up.
Okay.
Correct? So we're talking about breast enhancement surgery, whether it's breast augmentation, breast reduction, breast lift. We're talking about tummy tuck, whether it's a partial, a mini, a circumferential. And we're talking about liposuction, and then combining those things in a way that's going to give that particular individual the very best result.
What are the age ranges that you see?
Well, we see women in their mid-20s, perhaps that have finished their families early and are ready to get back into their bikini. We see women in their 50s who've long since finished their family but have never really had the time because of work or other constraints to be able to do something for themselves. So it's really a wide range of patients, but they share one thing in common. They want to feel better about themselves and better about their body.
Did you come up with this mommy makeover concept, the name?
I think the term has been floating out there, but it hasn't become a household name quite yet. But we see it more and more in the media. And it's just a catchy term that sort of encompasses what we do. And
is it becoming the most popular procedure?
I think it's spreading like wildfire through the internet. Obviously, we have so much information today. And ultimately, what people want is they want a good result. And they also want to do it relatively easy. They want to have one recovery if they can. Why split it up and have two recoveries, two payments, all that kind of stuff when they can just do it in one setting? So they want a safe procedure, they want a relatively quick procedure, and ultimately they want a beautiful result. And that's what they can get with mommy makeover, and that's why it's becoming so popular.
All right, now your background in training. We'll start with you. Tell me a little bit about...
Well, board-certified plastic surgeon. You know, I trained at the University of Texas in medical school and the University of California in surgery training. Been in practice for over 25 years in Northern California. And as mommy makeover kind of evolved as a procedure in my practice, you know, individualizing the techniques that are involved in the surgery, I came to see that to do this well and to do it in the time constraints that we needed to do it and to get the best quality results, I really needed a partner.
Okay.
I needed someone that we could work together that could make this procedure safe and effective, and by virtue of the time savings, also financially affordable for people to go in and have a total body sculpting, if you will.
What about your background training?
Well, I started out at Dartmouth College on the East Coast, moved sort of westward into Case Western Reserve in Cleveland, and from there I moved out to University of California, basically the same school that Stan went to, and did my general surgery and then on to my plastics fellowship there. And then established my own private practice and was in private practice for about 7-8 years until Stan and I sort of...
You guys just clicked right off the bat.
Well, we clicked even before that.
Oh, really?
When I actually got out of residency, we spoke, but it just didn't fit at the time. He'd just taken on an associate, and you know, things just didn't quite click, but we were always talking about it. It was always there in the background, and finally we got the chance, and we
so it's all for better results.
Ran with it. Absolutely.
Did you both always know you wanted to be a plastic surgeon?
You know, I think in surgery, most of the time you decide if you're going to be an internist or a surgeon, right?
Okay.
And once you get into surgery, you say, where's my special niche in surgery? And both of us kind of arrived at the same place at plastic surgery because it was such a creative field, if you will. And I think mommy makeover is probably the height of that because it allows you to take all the training that you've had, whether it's facial surgery, breast surgery, body contour surgery, liposuction, put all that into one patient and be able to create a result that's life-changing.
So is this truly a makeover? I mean, when you hear about this,
absolutely, and that's why we call it a mommy makeover. It's not body after baby. You could call it that. That's a little cliche term too, but it really truly is a makeover, and it changes a person's life.
You say it changes
their
their lives. How so? I mean, really?
It doesn't just change their body; it changes their entire attitude. And you'll see on some of the photos we're going to show you.
I mean, specifically there.
Well, it's just that it's a confidence level that they have. I mean, and we've all been there. We've gone to cocktail parties in the summertime, and some women are more dressed and sort of hidden, and they've got that little slump, and they're not feeling comfortable about themselves, and they're sort of hiding behind the drink. And then you got some other women who are out there, and they're flashing their midriff, and you know they're really showing it off, and you can see the difference.
So they get their body
in
back.
their personality. You change
is it like that?
Absolutely. They get the body back, and maybe a little bit more. Maybe they get a little bit more breast enhancement because they like what they had before, but they want a little bit extra. Okay. You know, they had a nice flat stomach, but now they're a little bit flatter and a little bit tighter and had a little bit more definition. They love that. And once they've had it done, now they're motivated. Now they're going to the gym. Now they love what they're seeing.
So defining it for me, a little bit of lipo, tummy tuck if necessary, breast enhancement in some way, lift or augmentation.
Well, you customize it for each individual person. I mean, and that's what's so important about what we do in our consultation is that we look at each individual person and we ask them questions about what bothers you and, you know, the regular questions that every plastic surgeon would ask him. But ultimately, we're going to put it all together and say, okay, well, we can do this with your breast and we're going to do this with your stomach. And when we show them that in the mirror, they go, oh my God, look at this. This is fantastic. This is great.
So over the years, you know, you've done a lot of surgery. Is this the happiest group of patients, people that go through this, this transformation?
I think absolutely, Randy. It really is, because it makes a change in their life and a change in their lifestyle. It allows the lady who thought she was never going to wear a two-piece bathing suit again to get back to the beach. It allows the person who never wore a low-cut cocktail dress to be able to pick out that cute little black dress that she always wanted. Those are things that are very specific. It's how you feel about yourself.
On the consults, I mean, do they tell you their motives? They say, hey, you know, I want to go to a reunion, I'm getting married. I mean, what do they tell you?
Well, sometimes they do. I mean, some people have a birthday coming up, whether it's 35, 40, 25, you pick it. They have reunions that they want to look better at. And now in this day and age, you know, a lot of people want to go back into the workforce. They're competing with younger people.
Interesting.
That's going to be important for them to look better.
You say in a recession, people are investing in themselves.
Absolutely.
Expand on
Absolutely.
that.
Yeah. Well, I think in a job, you know, you're going to hire someone to work in your particular line of business. You want that person to make a statement. You want them to act like they feel.
Well, being fit is actually a healthy look.
Right. It is a healthy look, and it gives the person
you always
confidence.
want to hire the person that looks the most energetic.
I'll tell you what, if you feel confident about yourself and your person because you're looking good, you're going to go to that interview and you're going to have that confidence, and that employer is going to notice that. Whereas if you're uncomfortable and you're trying to hide something, then
Good point.
you're going to notice that difference. So having that personality change because of the appearance change becomes so important.
Big boost in self-esteem.